Okay, um, not sure what's going on. I haven't pressed go live on YouTube. Now I have. So I'm not quite sure if I was talking all that long just by myself, but now we're live, okay? So let me start again from the beginning, because I think I was talking all by myself all this time. My name is Georgios, and I'm a professional that works with people with cancer and also men with prostate cancer, and I'm helping them increase the success of their cancer treatments, have fewer side effects, and live healthier, stronger, and better during their cancer treatments and beyond. And I also advise and help with prostatitis and an enlarged prostate, benign prostate hyperplasia. So that's what I tried to say in the beginning when I was talking about myself. I'll be here for the next 1 hour to answer any questions you may have about everything around prostate cancer, nutrition, lifestyle changes, exercise, physical activity, all that stuff. So I'm here. Please say hi, please share your story, and if you have any more questions, any questions for me, please let me know. I want to say hi again to John. I said that before, but I think I was just talking with myself because I hadn't pressed start stream from YouTube, on YouTube. So John, hi. And George, good morning as well. Are you in the United States? Here in Western Australia, it's 11 p.m. And what I was saying before, just by myself on my own echo chamber, is that my sound quality today is not as good because I had to sell my microphone. I'm leaving Australia. I'm currently in Perth, Australia, and I'm migrating out of Australia next week. So I'll be in Greece on the 28th of December, and I'll be staying in Greece. I don't know for how long, for a few weeks at least, and I will see where I'll be going afterwards. Maybe in Spain, but we will see. But actually it's gonna be making it easier for me to work, especially with men in the United States, which is most of my clientele, the men that I work with, because it's a bit closer in time. Okay. So George, you are from Boston, Massachusetts. Welcome. Thank you for joining us in your Thursday morning. Okay, for me it's 11 p.m. here on Thursday, Perth, Australia. You just finished your Lupron shots last week for 2 years and radiation last year. Okay, how are you right now? Lupron is one of the hormone therapy medications, the ADT, as we call it, androgen deprivation therapy, that is one of the most side effect inducing. Okay, I know it from my clients, from the men that I work with and the men that I have met during these past 2 years that I'm doing what I'm doing, that Lupron will bring a lot of hot flashes. It will bring fatigue, weakness, and a lot of just mental health is affected a lot. So George, do you still have the side effects right now? Okay, so last week you did your last Lupron shot. Okay, so Lupron is usually every 3 months, isn't it? Every shot is once every 3 months, and that will last now for 3 months. Have you done anything that seemed to help you in terms of nutrition and exercise with your Lupron? And what are some side effects that you still have? Now, for the men that I've worked with, especially on Lupron, which is still used quite a lot, I've got to say, it's the first, the go-to. Now, actually, some of my clients have started to go on Orgovyx, spelled Orgovyx. I have a video on my channel that I talk about the two different types of ADT treatments, and actually Lupron is a agonist ADT, whereas Orgovyx is an antagonist, which I have seen that it has less side effects, so the side effects are not as severe as Lupron. If your healthcare plan covers it, unfortunately in Australia it's not covered, Orgovyx, but in the United States it is under some networks and thing. So I would definitely recommend that. If you have to go on ADT, first ask your doctor if it's possible to do on and off ADT, so intermittent, which may not be possible after radiation therapy. There's a few things and I can talk about that in future videos, but if you can go on and off every 3 months, that would be good. Otherwise, Orgovyx would be better than Lupron. Hot flashes and frequent urination, yep. Stiffness in joints, okay. Look, George, I'm very happy to hear that the PSA is low now. Hot flashes, try to, look, if you're drinking alcohol, please get that off your diet. It actually makes the hot flashes worse. Spicy foods also make, even though they're healthy, spicy foods, and we're talking about spices like cayenne pepper, things like that, they're healthy. They make hot flashes worse. Magnesium seems to work. Magnesium seems to work to improve your sleep and also reduce the side effects from ADT. There are some other things as well, but I would definitely recommend, if you're on ADT, you definitely need to be supplementing magnesium, and specifically check at the back how much elemental magnesium you're taking. Okay, so even if the front of the supplement bottle says, for example, magnesium glycinate 500 milligrams, check at the back to see how much you're actually getting, because it's different how much you're getting the magnesium form versus the actual magnesium you're getting. John, thank you for commenting as well. John says, I have had my prostate removed in 2016 and had radiation 5 years later, then Lupron. Now had chemo for 6 treatments. Okay. Thank you for sharing that with us. I'd be interested to hear, okay, you had Lupron. What is your chemo? Is it docetaxel? Nubeqa and Lupron. Okay, so Nubeqa is, for those who don't know, androgen deprivation therapy is an umbrella term for many medications. There are medications like Lupron, which reduce the levels of testosterone, but there is also medications that but even if you take Lupron, there's still gonna be some testosterone circulating in the system. You need to further reduce in a bit more advanced cases, you need to reduce testosterone further and block testosterone receptors. So Nubeqa would be something like that. It is a very strong punch to give Lupron and Nubeqa, because it really basically eradicates all of the testosterone in the body and blocks the receptors of testosterone, so the side effects can be quite pronounced. Look, great to hear your PSA is 0.01. Sounds like it's in the undetectable range, which is good. John, how are you what side effects are you experiencing and how are you dealing with them? Have you found any ways to deal with the side effects, and what are the side effects? And especially I'd be interested to hear if you're doing something with, have you changed your nutrition, your exercise, anything around sleep, work, all that stuff that you can share with the men with us, just to give some tips. Thanks for sharing that, George. Yes, actually going low sugar, it doesn't, so just one thing, a lot of men with prostate cancer, they try to go ketogenic, okay, which is not, personally, I don't recommend the ketogenic diet. The people that I work with cancer, they tend to go into two separate camps. They will either go ketogenic or vegan. Which I gotta tell you, for prostate cancer, okay, prostate cancer is a cancer that is affected by the amount of fat you're eating. So when you go on a ketogenic diet, with ketogenics, I think 60 to 70% fat is not good, and especially saturated fat. Now, I'm not saying you should not eat meat, or you should eat zero protein. That's the other extreme. But you need carbohydrate, not necessarily in the form of white sugar or flour, but green vegetables, and especially cruciferous vegetables like broccoli, cauliflower, kale, Brussels sprouts, cabbage. That stuff are absolutely amazing for prostate cancer. You need them for good health. You need to get some nutrients in those vegetables, the sulforaphanes, which are good for bone health, which you need especially during ADT. And all that stuff are gonna give you the fiber you need and gonna give you some carbohydrate, which you need to then be able to exercise at higher intensities. Okay? So definitely yes at reducing sugar, reducing white flour. Red meat is okay. Introduce fish into your diet. It matters how you cook the meat, okay? So not charring the meat, but red meat is gonna give you the protein that you need to sustain your muscle, especially during ADT. What I would recommend you reduce as well is dairy. If possible, eliminate dairy or eat it very, very rarely. Okay, dairy is not good for prostate cancer, I gotta tell you. Great to hear, George, that you're eating green veggies. Yes, go plant heavy. Prostate cancer needs to be plant heavy. Can half or more of your plate be colorful vegetables with very little to no fat, maybe just a teaspoon of raw extra virgin olive oil just for garnish, and just play with the herbs and spices. That's good, but a lot of plants. Plus have your protein, which could be lean cuts of red meat, lean poultry, and also things like legumes are good, okay? So Joe, you touched upon exercise. I want to hear what you are doing for exercise, first of all. So I could be here talking and talking, and I'm doing that on my YouTube channel. I give videos, but here is also a time for you to tell other men watching this video what you are doing in terms of exercise, nutrition, or what you're experiencing. When it comes to exercise during androgen deprivation therapy, if you're taking some sort of testosterone suppression or anti-androgen like Nubeca, there is a huge need to do weights, okay, resistance exercise, build strength. It is possible on heavy ADT to build strength and even build muscle. I have done that with men in their 60s. We build actually muscle upon starting Lupron. That was also part of a research study actually, and that definitely needs to happen. One more thing that is very, very important to do especially during androgen deprivation therapy, is some sort of impact. What is impact? Jumping, for example. Why? Because impact builds bone. That's how bones are built, okay? Apart from the nutrition side, which I can talk about in future videos, you need to also take some supplements. The way to build bone, not just maintain bone health in bone mass, but actually build bone, the bone mineral density, which you can diagnose and measure in a DEXA scan, that needs to have some sort of impact. So jumping, bounding, hopping, skipping, all that stuff. And what we have done in the Exercise Medicine Research Institute, that's a great research center here in Australia, Perth, Australia, they were combining resistance exercise with a module of basically like bounding and jumping. So they were able to preserve bone health and the bone mass in men starting androgen deprivation therapy. So these are very important, okay? If you are not that able to jump and you haven't done that before, one tip that I'm gonna give you now is get a trampoline. You can go to places with classifieds, just use like Facebook Marketplace, get a trampoline, start by jumping on that so you can build a little bit of your lower limb strength, so you can then do some sort of jumping like skipping rope, running, jumping on, doing some jumping jacks every day. These things, especially the impact, that builds strength, okay? So definitely you need impact during ADT. Okay, so John, you've taken an injection for osteoporosis. Is that, I keep forgetting the name. So there is two main ways that these injections for osteoporosis. One is biphosphonates. The other one is denosumab. That's more of a antibody. Just be careful if you have anything with your kidneys with biphosphonates. Okay, it might affect your kidneys. So if you have anything with the kidneys, let your medical professional know, and maybe it's better to check and do the denosumab when it comes to having an injection, especially if you're at risk of osteoporosis and you're already on ADT. Also, ask them what you should do, because you should have actually a jaw examination. Check your teeth, because once you start, you won't be able to change that. They will know what to tell you. So George, talking about everything, walking barefoot outside, look, that is good, but if you are, if you can walk and run for prolonged periods of time without wearing shoes, that's great. Not many people can do it, but I would prefer you do that at some point. I don't know, you go outside, you sit on the grass, you read a book, and you are not afraid of stepping on something. But when you go out to run or walk in nature, yeah, just wear some proper shoes so you don't develop anything in the foot, in the fascia. I prefer to do that, to touch grass, either when I go to the beach or when I sit outside on the grass and I read a book. That's good because I know there's no glasses or anything there. I'd like to ask you, are you doing any resistance exercise, lifting weights? Are you doing that at all? And if yes, can you tell us how often per week? What kind of weights? Are you doing barbells or machines, sets, reps? What have you noticed with that? Or are you thinking of doing it? You're not doing it now and you want to learn how to do it? So maybe we can talk a little bit about the exercise. For those who are joining us now, welcome. Please share your story. Tell us when you were diagnosed with prostate cancer, what treatments have you underwent so far, what you're currently undergoing, and especially I want to know about what changes you have done in terms of nutrition, exercise, physical activity, lifestyle modifications, supplements, all that stuff. Please let us know. Share with other men watching this that might benefit, and ask me any questions you want. I'd love to hear about you, your story, and meet you. And as I was saying, I wanted to do one last live stream while I'm still here in Perth, Australia. Next week I have to migrate out of Australia, and that's why the sound quality is not that good today, because I actually sold my microphone. I'm gonna buy a new one, and next week I'm gonna move to Greece for some weeks. I don't know for how long, but then the next day stop would be somewhere in Europe, probably Spain. And yeah, basically what I'm gonna do there is exactly this. What you're doing now, what you're seeing now on YouTube, is basically gonna be my job, my full-time job. I'm gonna be making videos for this channel and also some other channels for different types of cancer. Prostate cancer is definitely one of my, especially the men with prostate cancer are very close to me and my heart, and this will be one of my primary channel basically. And yeah, I wanna move to a place that is gonna allow me to do only this. Talk with men around the world with prostate cancer, help them through exercise, nutrition, lifestyle modifications, mindsets, to live healthier, stronger, succeed more in their treatments and with less side effects during their treatments and after prostate cancer treatments. So yeah, any donations, especially if you buy me a coffee, you can see the link up here in the description. I've got also the link in the description. That helps me do that full time, so thank you for that. Hi Shoes. Okay, prostatitis. Have you done any examinations about it? Is it chronic or is it acute? So George is telling us, yes, I have resistance bands and weights. I was in a 16-week program on Zoom with monitors watching me do my routine, 3 days a week cardio, weights, legs, okay, etc. That's great. Look, I've got to say that a lot of men that I work with, they want to do everything at home, and that's possible. That is certainly possible. You can build a lot of strength, a lot of muscle. You can increase your strength, your functional strength as well, your stamina at home. A lot of exercises at home. So that's possible. I would challenge you, however, and I will recommend you at some point in your life, try going to a gym. And it doesn't have to be, you don't have to suddenly start taking supplements and protein powders. No, you can find a local gym and it's quite cheap nowadays, and you can actually benefit from having some high quality equipment and doing a program that is going to be very effective to build strength. And actually, it's not a fantasy, it's not something that you can only dream about. I've worked with a lot of men and we actually doubled and tripled their strength while on ADT, and they were taking both Lupron and anti-androgens, okay? So you can actually build strength, you can feel strong, and if you build physical strength, if you observe yourself doing twice, lifting 3 times what you lifted before, well, that's somehow, that increase, we are men, and this increase in physical strength, I guarantee you will have a tremendous amount and improvement in your mental health. So, yes, you can do great stuff at home, but there is a great feeling at lifting a barbell. So I tried with a lot of men that I work with to get them to try, at least at some point at the gym, if they're happy to do that. Otherwise, at home, yes, we can work with doing some push-ups, resistance bands, resistance tubes, all that stuff, kettlebells, still good. Rodzal, I haven't read this book. It's on my reading list. I want to read it. I've got a lot of books on prostate cancer that I want to read. A recent book that I've read about prostate cancer, it was called, I think, Prostate Cancer, Wolf or Sheep. So it was a story of a man, basically from diagnosis till today, he's alive, he's finished, I think he underwent surgery and then radiation treatment in different places in the world, and he's talking about his experiences with it. So that was interesting, but that's also on my reading list. Choose about the prostatitis. Just out of curiosity, did it start after sexual activity? How did it start? George, that's a great question. So George asks, if basically you built your natural testosterone when you're exercising, will the increase of testosterone bring the cancer back? The answer is no. Okay? So, if you're on ADT, your doctor basically wants to suppress the testosterone. You cannot increase testosterone with natural methods such as exercise, nutrition, all that stuff, or let's say the sun exposure also increases testosterone. So when I want to build testosterone in men, I'll give them a program, and that we will see an increase in testosterone. I'll help them naturally with also some supplements. But it is extremely hard to overcome the testosterone suppression from ADT. Once you're on Lupron, you cannot, with exercise, nutrition, and other things that are non-pharmaceutical, to overcome that testosterone suppression. It's very powerful. When your doctor is not putting you on ADT, you finished your ADT treatment, then it's okay for you to exercise and do everything to restore your testosterone levels. That will not drive prostate cancer growth. Definitely, exercise actually has been shown to decrease prostate cancer growth. Things that make you healthy will not overshoot your testosterone more than its natural limit. So when for example, I'll get a young man in his 30s who's suffering from low testosterone, and I'll try through exercise, nutrition to restore their testosterone. What I'm doing is basically bringing the testosterone back to its natural levels that it should have been. Now it's suppressed. We cannot go over that. The body has a natural regulation system. So when you're off ADT, and then your doctor is okay, we are okay, we can bring back the testosterone to natural levels, and exercise increases the testosterone, that's natural. You will not increase your testosterone past what your body can do without medications, okay? So that would be my answer to that. Russell says, hi, I was diagnosed 2 years ago with an MRI, then a 15-core biopsy, which they concluded a 3+3 and a pyrides of 5. They have me on active surveillance and had another MRI and no change with a PSA of 3.1. Thank you, Russell, for joining us and for sharing that. Look, as scary as a prostate cancer diagnosis can be, a Gleason score of 6 is, yeah, it's actually good. Some people may think is a good thing, because actually now it has made you very serious about your health and very proactive. We're slowly entering the era where prostate cancer will be managed as a chronic disease rather than a cancer. I've worked with cancers that are very aggressive, like stage 4 pancreatic cancers, which is basically the worst, and colorectal. So when you compare that with prostate cancer, it's completely different diseases. With the advances of prostate cancer, it's starting to become like a chronic disease, okay? Active surveillance is definitely a good time. I like the word active surveillance. There's also the term watchful waiting, but I don't like the word waiting. I prefer the word active surveillance, because now is the time to get active. If you haven't put exercise and nutrition as a priority before in your life, now is the time. Okay? I almost want to tell you that now on active surveillance, and always during cancer, but especially on active surveillance, your primary treatment is exercise, nutrition, and lifestyle modifications. Of course, when if there is a need for a medical treatment, I'm not saying don't do it. Of course, all my programs are supposed to work alongside medical treatments. But during active surveillance, when you're not receiving a pharmacological treatment for the prostate cancer, it's up to you. You are the person who needs to be very proactive with exercise, nutrition, and lifestyle, and your mindset as well. Because at the back of your mind, you always have the anxiety of, I have cancer. So, yeah, be very active during active surveillance. All throughout any stage of prostate cancer, you need to be very active about those things. But yeah, active surveillance is a time to be very active about those things. Russell, that is interesting that they want to do another biopsy. Look, I cannot advise. That is gonna be medical advice. What you can always do is get a second opinion by someone, by a urologist or an oncologist who is gonna be specialized on prostate cancer. Sounds like you had a lot of biopsies, 15 cores there. So they took a lot of samples from your prostate. So yeah, I understand. I haven't personally experienced, but I know from many men that I heard the story how painful a biopsy can be, and after days you basically pee blood and all that stuff. So yeah, I would say maybe get a second opinion, but that's, you know, it's up to you. And of course, you know that whoever you ask, if you ask about a radiation oncologist, they'll tell you you need to do radiation. If you ask a urologist, they'll tell you need to have surgery. So yeah, it's a little bit of a... That's why I recommend men, if you can, go to a prostate cancer support group. I personally go to regularly here in Perth in prostate cancer support groups, and actually it was last week that I gave a presentation in the largest prostate cancer support group here in Perth, Australia, on exercise, nutrition, lifestyle, all about that during prostate cancer. However, in a prostate cancer support group, they're not... Yes, there is emotional support, there is camaraderie, and that's important. It's not a time to be alone during prostate cancer, definitely, and we men are very good at hiding stuff and being ourselves and trying maybe to protect others from and not spread our negativity, our anxiety, our fear on them. It's not a time to be just by yourself during prostate cancer. But in a prostate cancer support group, there are some gold nuggets. Men in your area will be able to give you local tips on go to that doctor, go to this nurse, go to that center, ask about this, ask about CyberKnife, ask about MRI, LINAC, ask about proton therapy, or even focal therapies now. So maybe that's something that you can ask as well, Russell. I have heard stories of people with... I've had actually clients with focal therapies do that, such as, I don't know if you know about focal therapies, the new, it's called NanoKnife. And I actually had an article here about NanoKnife. Oh, here it is. the new treatment called nanoknife, which is basically hitting the area of the prostate with the cancer with electricity, so basically destroying only the tumor and leaving the other prostate intact. There's things like high intensity frequency ultrasound, which basically warms the cooks the cancer. And there's other things like cryotherapy. There's a lot of focal, so localized therapies now developed, and especially for Gleason 6 prostate cancers, which is the majority of diagnosis. So I've heard stories that these things actually there was a recurrence, but a recurrence can exist also with other types of cancer. So you need to be aware and ask them, is that the right treatment for me? If, for example, your cancer is a little bit on the outer layer, or it shows some forms like the cribiform is there, and also intraductal carcinoma, okay? So it has cribiform pattern. These things are all indicators of aggressiveness, which you would have gotten with your biopsy report, okay? Okay, so just ask all those things. But prostate cancer support groups, men, I would recommend you, gentlemen, you go. Because apart from the emotional support, camaraderie, you also learn a lot of info in your local area. Thank you, guys. Okay, so for example, Boom Boom, that's a nice username. Says, I've been diagnosed about a year ago, been going through treatments for about that time. I take Orgovyx and abiraterone, I think you wanted to say. So this is the medication that I was telling you about. Orgovyx is the newer form or a different form of ADT, which is a bit more gentle in the body and especially the cardiovascular system. So Lupron is not, I'm not saying don't take Lupron, but I'm saying if you have the chance, go more Orgovyx. If you can, if your healthcare provider or your insurance can cover it, definitely Orgovyx, I would say. But of course, you follow the advice of your medical professional. So I wanted to ask, okay, Boom Boom, you're talking Orgovyx and abiraterone. Can you tell us a little bit about your side effects and how you're managing them? And especially if you're managing them with exercise, nutrition, all that stuff, or just occupational therapy. Basically, what have you changed in your daily life to be able to work around your side effects? I want to hear from someone, and actually the stream is gonna be up for the next 10 minutes. I want to also hear from anyone who has done any of the SBRT, stereotactic body radiation therapies. Things like CyberKnife, or things like MRI LINAC, or proton therapy. There is the traditional radiation therapy, which takes anywhere from between 28 to 39 radiation sessions, and you have to go 5 days a week with a full bladder and empty stomach. but there is some other forms of radiation treatment which only take like 3 to 5 sessions, which can deliver very strong radiation therapy, very targeted and very thin beam. So it can reduce the side effects of radiation therapy because it's so targeted. Has any of the viewers done any of these forms of SBRT? And if yes, have you noticed side effects? And as I said, the stream is gonna be up for the next 10 minutes. Please ask me your questions, especially nutrition, exercise, lifestyle for prostate cancer. As I said, this is the last stream I'm doing in Australia. That's why I wanted to do it. I'm migrating out of Australia next week, and I'll be doing what I'm doing here on YouTube and on my website, which you can find in the description, the link in the description, full time. So if you wanted to support me, you can buy me a coffee using the link in the description that you can see up here. If you want to talk one-to-one with me, please visit my website. I can actually give you a 15-minute free chat to see if we're good. If you can tell me your story and I can tell you if I can help you, if I sit down and do a full consultation with you, go through your medical history, ask for any blood reports, and then I'll create a program with nutrition, exercise that will fit your busy lifestyle and your preferences. You can work with me using the link on my website. Fatigue, hot flashes. Okay, these are the ones that are very, very, very common during ADT. And that fatigue is usually fatigue that doesn't go away with a nap. It's always there. How are you dealing with them? Have you found any ways to... What would you tell a man with prostate cancer just starting on ADT, based on what you have learned through your own experience, how to manage fatigue, hot flashes, weakness, and all the side effects that come from ADT? Anyone who'd like to share? Please. And I want to thank everyone who joined today. It's lovely to, it is a great feeling to talk with men all around the world and connecting together. And if I can help in any way, I want to. It's a challenging journey. It can be, but it can be less challenging, and I want to help with that. Shus007, thank you for the recommendation. I will reach out to this professor. I'll search him, Mark Emberton from London. Okay. I actually want to bring guests on the channel. I want to get people, not just medical oncologists and urologists, physiotherapists, sexual health nurses, in general, people who you might not be aware of, professions that you might not be aware of, to share their inputs. And I want to basically interview them and ask them questions that I will ask you to provide me the questions that you want to learn from these professionals, so they can give us their professional input. I will be wrapping up the stream in the next 5 minutes. Do you have any questions for me that you'd like to ask? Actually, I want to ask, is anyone doing a ketogenic diet who has joined the stream, or a vegan diet? Or Mediterranean diet, which actually is a great diet. And that's not because I'm Greek. I want to do a future live stream, which I'm gonna start doing more frequent in the next year, okay? And I want to have a single live stream for supplements. What supplements you're taking, herbal, natural, or more or less natural supplements that you found help. I've got a lot to share that I give to my and recommend to the men that I work with according to the side effects we're trying to reduce or the things we're trying to improve in their health. But yeah, I'll be interested to hear about the supplements, and of course a lot of videos that are coming about nutrition principles. You still have a chance to say hi, and I want to hear from where you're joining us today. What time is there where you're joining us? How's the weather? Here in Perth, Australia, it's very hot. Today it was 35 degrees and we have beautiful beaches and the ocean is beautiful. That's why I'm kind of sad also to live, but well. John is telling us I'm on Lupron. I started an exercise program before my first shot. I walk, run, hike, bicycle, etc. 6 days a week. Side effects are minimum. Well done, John. And actually, I've seen that the men who experience the hardest side effects, usually, there's always exceptions, but usually people who are not that active, who are not that proactive with nutrition, they tend to experience a bit more severe side effects. Most of the men that I've seen, that they were already doing resistance exercise a few times a week. They were doing cycling, running. They were saying, yes, I understood and I felt more fatigue and it was a bit difficult, but nothing too major. The stories were worse. I've got to say, if you're not one, and typically the people who watch my channel are already a bit biased and they're already exercising a little bit more than the ones who actually need to be watching my videos. It's not too late. I've gotten men months into ADT, and actually you can watch a video testimony that I have on my channel, on my website. You can go to my website, healthierthroughcancer.com, check the testimonials from resources at the top, testimonials. I've uploaded a video, and John, one of my clients, actually has built strength, and he's already 10 months into ADT. So it's never too late. Yes, it's the best if you start doing all the good stuff, the specific exercise programs, the nutrition, upon starting ADT or before, years before. But as they say, the best time to plant a tree is 10 years ago. The second best time is now. So you can start now and you can make an enormous difference in your health, your muscle, your body, how you move, what you can do during the day, your stamina, your energy, okay? So gentlemen, I wanna wrap up here. I hope, well, first of all, thank you for joining me. Thank you for sharing this time with me. I really feel great connecting with people who watch my videos throughout the world. It's amazing. Please feel free to send me a message. If I can help you, I'll do that for free if I can. You can visit my website using the link in the description, healthierthroughcancer.com. It was a pleasure hearing your stories. I hope I helped you a little bit today. If I didn't, please send me a message. I will be happy to send you a bit more personalized advice. And I want to tell you, keep going strong, exercise, eat healthy, eat clean. It matters, gentlemen. Even though you might not see it in 1 or 2 days, over time, the little small differences you make in your daily life, you've got 24 hours during the day, the small modifications you do towards a better health compound, and they make a huge difference weeks and months down the line. Okay, and actually they feel good. It feels powerful to say, look, I'm making this choice not because my tongue is forcing me to do, or I don't feel good, so I'm doing this because I care about me and I love me and I want to be better, I want to be healthier. It's good, it's powerful, it's empowering. Of course, you won't be perfect. You'll want to have a little bit of a drink, a little bit of a dessert, a little bit of cheese here and there, but that's okay. As long as the majority of your choices are towards a better health, well done. I'm very, very happy to see men during prostate cancer not being trapped from side effects and choosing to still do things that make them feel alive, like exercising, walking, out in nature, doing all that stuff. I hope you have a beautiful holiday season. Merry Christmas to those who are Christians, and a Happy New Year. I will be making my future videos from Greece for a few weeks, and then who knows from where. If you wanted to buy me a coffee for today and also support my journey to be able to do this full time, I'd love if you bought me a coffee using the link in the description. Otherwise, keep tuned to the channel. I'll have big plans for the channel, and I want to make videos that will help a lot of men. Thank you so much. Have a beautiful day, and I'll see you.